Hi, my name is Nicole. I'm a licensed clinician, and I'm here talking about everyday things that impact our mental health and fitness. I started talking a little bit about some parenting stuff, and I also want to acknowledge the fact that, men still kind of really aren't considered in the equation when it comes to things like pregnancy or fertility issues or pregnancy loss. Um, Obviously, there's this whole debate about abortion and if it's right or wrong or what have you. Um, what I've I've noticed though is that when I've had friends or people that I know who have been informed of a pregnancy that was willingly terminated by their girlfriend or whatever, um, a lot of them were not happy about that. Um, I guess I'm fortunate in that I get to surround myself with good, decent men um, who would be willing to rise to the occasion. And it it was something that was very hurtful and harmful for them to find out afterwards that there was this potential for a child and that they weren't even told or consulted, and then it was just the woman's decision to um, terminate that pregnancy. And so, looking at if they're in like a committed relationship with somebody and they're trying to have a baby, things like pregnancy loss, miscarriages, you know, fertility treatments maybe not taking, and it taking a long time to get pregnant, like that all also takes a toll on men. The pregnancy itself can be very stressful, just thinking about like how is life going to change, and you can talk about it and you can imagine it to your heart's content, but then like when the reality happens, it's completely different than what you were kind of anticipating. um but it can still be a source of anxiety for a lot of men. And then also thinking about like, hey, like there's a lot of things that can kind of go wrong in a pregnancy, either for just the baby or for baby and mom, um, or just for mom. Sometimes things happen when mom is delivering, and maybe mom doesn't get to come home. So, kind of like those things are things that very often go through men's minds. Like what do I do if that happens? How do I recover? How do I go on grieving the loss of, my spouse or my partner, and also having to figure out how to be a father and care for this newborn without the maternal instinct that would come with the mother. Not saying that fathers don't have a paternal instinct, but it's different, right? Like we're very different creatures. It's very different when it's a human being that comes out of your own body. There's a different bond and different instincts that kind of kick in with that versus being the father and having those paternal instincts of protection coming into play. So, looking at all of that and then looking at like, hey, postpartum depression, people are talking about it now, and that is amazing. It's like about time because, I mean, it's not like brand new, right? But like, I mean, I feel like in the past maybe 15, 20 years has become more of a thing to talk about. And we've been having babies since like literally like the dawn of time. So good for us for finally like catching up, but we're recognizing it now. What we're not really doing is recognizing postpartum depression that happens in men, because very oftentimes they keep it together to support the mom in her initial bonding with the baby, and like if you're breastfeeding or what have you. Um and she gets to get off of work and get maybe 60% of her pay in the United States if you're on short-term disability. Very oftentimes, depending on the father's job, he might not get off at all, or he might get FMLA but without pay because it's not his disability, right? Um, so oftentimes he doesn't have the opportunity to bond with his child and also be able to have the family's income be something that's sustainable to support that child. Just a whole nother video just ranting about that. But anyway, so he's holding it all together. You know, everybody kind of figures out a little bit of a routine. 6 to 8 months later, that's usually when postpartum depression hits men. Who knew? I didn't know this until I was talking to my therapist about it, who is a specialist in postpartum depression and perinatal, prenatal type of things. I wanted to get a little bit ahead of the game. So I started talking to her while I was pregnant, and we were able to sit down with her and have a session and just be like, "Yo, like, what do we expect, right? Like, what do we look out for as far as like for me, like postpartum depression, for him, postpartum depression, like what does that look like?" Um, and so I think that there's like a huge knowledge gap and a huge specialization gap in the mental health and therapeutic world, where we're not really doing enough service for men in these situations. And it's really kind of sad, because again, like, they kind of start out with that lack of support and with like kind of like being marginalized in that situation, which I think then lends itself to being feeling a little bit less necessary, as you kind of move forward. So let me know your thoughts in the comments.